Okay, so this is going to be my second health assessment video. I didn't have a patient, so I'm just going to use myself and kind of explain my thought process and like my steps for what I would do if I actually was doing this on a real patient. So I would first start off by just knocking, coming in the door, providing privacy, doing my hand hygiene, acknowledging my patient, introducing myself as the student nurse or the nurse, explain to them what I'm about to do and how long it will take, and just make sure that that's okay with them. After that, then I would thank them for, letting me do that. I would then look at their ID band and ask them their name and their date of birth, just to identify with 2 patient identifiers. Next, I would assess pain, and I would also assess if there's any allergies. Then I would start off by just inspecting the face. So I want to see if their mood is appropriate for the situation. I'm looking for any deformities. So I want their face to be symmetrical with no facial drooping. I want to make sure that they don't have any edema, any masses, or any lesions. After that, then I would just inspect their head. So I'm looking for a normal cephalic head that's midline and doesn't have any deformities. The next thing I would do is assess the TMJ joint. TMJ joint. So I would put my fingers here and have them open and close their mouth. And I'm just assessing for like any cracks or any pops, which I do have, so that would not be normal on a patient. So I would note that. After that, then I would move to the skin. So I would just kind of palpate just like an open area of their skin. I want to make sure that it's warm and dry and intact. In a normal patient, they would be wearing a gown. So I would be able to do a thorough skin assessment, but obviously for this video, we don't have that luxury. So just making sure that they're, it's intact, there's no lesions or anything open. You want to note any different like textures. If they have an abnormal thick skin or something, it shouldn't be that way. It should be smooth. It should be normal texture. It shouldn't be super dry. The next thing I would do is assess skin turgor, and I would just lift up a piece of the skin up here and just make sure that it's elastic. So if it's elastic, then it usually you can assume that they are not dehydrated. Next, I want to assess if there's any scars and if they have any tattoos, which I do have tattoos, so I would be positive for tattoos. Next, I would move on to the hair. So I would just kind of inspect and palpate their hair. I have brown, kind of thin, kind of thick hair. It's kind of curly. It's evenly distributed. I don't have any bald spots. I don't feel any lesions, but I would want to check very closely for any of that. I do wear glasses sometimes, so I would want to check for any like skin breakdown behind my ears, because that's a common spot. I have fine zealous hair all over my body. Well, most of my body. I don't have any infestations. Okay, so after I have assessed the hair, I am going to move on to the neck. So the first thing I would do is just have them do a little bit of like range of motion. So I want to have them like look to one side and then look up and then look down and just ask and make sure that there's no pain or anything like with that. Next, I would look for any JVD. Mine is normal. I would then assess their carotid pulse one at a time. And that's noted to be strong and palpable. Next, I would just make sure that my trachea is midline, which it is, and you can just kind of palpate that. And then the next thing I would do is you can either stand in front of the patient or stand behind and just kind of feel around like for the thyroid, and just note if there's any enlargement or if it's tender, which I don't have any enlargement and I don't have any tenderness. Moving on to the lymph nodes. So the first thing I would do is I would do the pre-anorical, and then I would move to the post-anorical, and then I would move to the occipital, which is right here in the back of the head. Then I would move down to the submandibular, and then the submental, And then I would move down to the jugular digastric and just kind of palpate that, and then palpate down the cervical ones. And then lastly, I would have them kind of like shrug their shoulders, and then I would just look right in the clavicle and just kind of feel if there's any present lymph nodes. They shouldn't be tender, and you shouldn't be able to feel them unless they are sick or they have a cold, which I didn't feel them on me, and I don't have any tenderness. Lastly, I would assess the nails. So looking at my nails, they're rounded, my nail beds are pink. When I do cap refill, it's less than 2 seconds, it's very quick. I don't have any ridges, I don't have any clubbing. When I do the shamrock test, they're approximately 160 degrees, and they're clean and they're smooth. And that's pretty much it. So after my assessment, then I would just reassess my patient's pain and just make sure that they're not in any pain now. I would offer them like a blanket, or if they wanted something to drink, just make sure that they don't need anything else before I leave the room. And then I would just thank them for their time. And I would exit the room and I would do hand hygiene on my way out.